What causes diabetes? Type 1. In type 1 diabetes, your body doesn't make insulin. This is because the immune system attacks and destroys the cells in the pancreas that make the insulin. Doctors aren't sure why this happens. Type 2. When you eat, your body changes most of the food you digest into glucose, a form of sugar. A hormone called insulin allows this glucose to enter all the cells of your body. There it is used for energy. Insulin is produced by the pancreas. In someone who has type 2 diabetes, the pancreas doesn't make enough insulin or the body's cells can't use insulin properly, called insulin resistance. This causes glucose to build up in your blood instead of moving into the cells. Too much glucose in the blood can lead to serious health problems that damage the blood vessels, nerves, heart, eyes, and kidneys. Certain risk factors for type 2 diabetes include weight. Obesity is the single most important risk factor for type 2 diabetes. The more overweight you are, the more resistant your body is to insulin. To figure out if you're overweight, talk to your doctor. A healthy, low-fat diet and regular exercise can help you lose weight gradually and keep it off. Age. The risk for type 2 diabetes increases with age, especially after you're 45 years old. Although you can't change your age, you can work on other risk factors to reduce your risk. Family history. You can't change your family history, but it is still important for you and your doctor to know if diabetes runs in your family. Your risk for diabetes is higher if your mother, father, or sibling has diabetes. Tell your doctor if anyone in your family has diabetes. Pregnancy. Gestational diabetes is a kind of diabetes that happens only during pregnancy. Although gestational diabetes goes away after pregnancy, about half of women who had gestational diabetes are diagnosed with type 2 diabetes within 15 years. Even if they don't have gestational diabetes, women who give birth to babies who weigh 9 pounds or more are more likely to develop type 2 diabetes later in life. The American Academy of Family Physicians (AAFP) recommends screening for gestational diabetes in pregnant women after the 24th week of pregnancy. The AAFP believes there is not enough evidence to determine the benefit and harm of screening for gestational diabetes in pregnant women before the 24th week of pregnancy. Polycystic ovary syndrome (PCOS). This is a condition that occurs when an imbalance of hormone levels in a woman's body causes cysts to form on the ovaries. Women who have PCOS are at an increased risk of developing type 2 diabetes. Smoking and alcohol. Alcohol and tobacco use may increase your risk of type 2 diabetes. Stop smoking as soon as possible. It's probably okay to drink some alcohol with a meal, but you should only have one serving each day. Less is even better. A serving is 4 ounces of wine, 12 ounces of beer, or 1.5 ounces of hard liquor. Race, ethnic background. Some ethnic groups have a higher risk of diabetes than others, including Native American, Hispanic American, African American, Pacific Islander. The risk of developing type 2 diabetes increases with the number of risk factors you have. If you have 2 or more risk factors, talk to your doctor about how to delay or prevent type 2 diabetes. If you want to learn more about diabetes, please click the blue link in the description. Subscribe our channel for more videos.